When I started learning about lymphocytes, they were small and innocuous in the textbooks. Like they wouldn't be too hard to understand. Lies, I tell you, all lies. Once you start going deeper and begin to look down the microscope, you realize the confusion that these cells can cause. But you guys have a secret weapon, me. So don't worry, I've got your back. Hi everyone, I'm Stephanie and welcome to Heme Ed and Lymphocyte Basics. Today, I'll be teaching you some fundamental knowledge about the lymphocyte. That way, when we get to the complicated stuff in the future, you'll know what's going on and won't get lost. Lymphocytes are the second most numerous WBC in the adult body and the most numerous in some pediatric age groups. There are 3 different types of lymphocytes. B lymphocytes, routinely called B cells, get their name because they develop in the bone marrow. They are part of adaptive immunity and are the antibody-producing lymphocyte. They have the ability to differentiate into the antibody-secreting plasma cell. T lymphocytes, usually called T cells, get their name due to developing in the thymus. They are part of adaptive immunity but deal with cellular immunity. Natural killer cells, also known as NK cells, are part of innate or non-specific immunity and can develop in either the bone marrow or the thymus. Both resting B and T cells are morphologically identical on the slide and usually appear to be small lymphocytes. Natural killer cells are slightly larger and contain azurophilic granules, which are also similar in appearance to cytotoxic T cells. In reality, these cells are indistinguishable from each other on a slide, especially if they are doing a job. So for all intents and purposes, they are one group when performing a differential. If a distinction between the different lymphocytes is required, flow cytometry needs to be used. But the background knowledge is vital for when we start getting into when to call a cell normal or abnormal. A few things make lymphocytes different from other WBCs. 1, they have a resting state, which means they can reactivate and go through mitosis if they get stimulated. This is why they sometimes look like they have a buried nucleoli if you look closely. They're waiting for something to happen and have the ability to jump into action. 2, they can leave and re-enter the bloodstream. Other WBCs, when they leave the bloodstream and go into other tissues, they can't come back. But lymphocytes have free reign. 3, T cells and NK cells develop and mature outside the bone marrow. This is why with certain bone marrow disorders, the lymphocyte values will maintain a normal level. So today, we learned about the basics of lymphocytes and some of the things that make them different from other white blood cells, and how hard they are to tell them apart morphologically. In the next couple of videos, we'll be using the knowledge you acquired from both this and the previous neutrophil video. If you have any questions, leave them in the comment section below. Subscribe for future content. References are available in the description box. Until next time.